Did you listen to Jeff and Professor Hamo in the morning? Here's what you missed.
Oh, she hasn't gone to sleep.
Oh.
Bado ni jana. Yes.
Okay.
Yeah.
Baby, lock the door and turn the lights down low. With the music on the soft and slow. Oh, yeah.
Baby, we ain't got no place to go.
I hope you understand. John Gurugwe, all the way from Doha, Qatar.
Kabisa.
Moto kama pasi.
Oh, man.
Yes.
My man. Hii ni bana. Gongu Kigali. Hana kitu ya kusema.
Hey, by the way,
yes.
Did you see the other day, was it yesterday, someone was resurrected?
Nilikwambia nini? My movie. I told you we need to up our game.
Someone was resurrected.
Baka akapatiwa chakula.
Na akaanza kukula. Na gloves. Alikuwa na gloves.
We need to do something. Katiba. Hii studio ilivampiwe so that we can tukianza kubroadcast tukiwa tumeinama. You know, if we can come up with new ways of doing things.
Yeah.
Oh, that is pushing it.
Speaking of new ways.
Oh man.
Let's talk universal healthcare.
Mara moja.
Something that's very ambitious. But it's still part of Agenda 4, let's not forget, right?
Part of all the dams.
Big four.
Yes.
It comes with the dams and the big four. Is universal healthcare attainable? Well, there's a group of young people who think it is, and it must be by the year 2030, in fact. Universal health coverage by 2030 in Africa. Okay. That's 11 years away, Prof.
Kwa hivyo tutakuwa tumemaliza hii yetu ya hapa kwanza locally, alafu ndio tuende Africa.
Wengine watakuwa wameresign.
watakuwa kwa jam. Watakuwa kwa jam. So you realize,
yeah.
Is this ambitious?
Let's find out.
Yes.
In the studio live is Sylvia Wamugi, communications manager at AMREF. And Sylvia is here to talk about not only universal health coverage in Africa by 2030, but also there's a conference next week in one of my favorite capitals on the continent, in Kigali. Yes. To talk about health and more health. Sylvia Wamugi, welcome to Hot 96.
Thank you.
Good to see you.
Thank you.
So, as Prof said, pretty ambitious.
Yes.
Universal health coverage in Africa by 2030. Forget about it. Let's talk about Kenya first.
Yes. Kenya, yeah, 5. Tulikuwa tumepatiwa 5 years. The big 4 agenda.
Big 4, which is now the big one.
Yes, it is all a dam. Right.
Okay.
Is it attainable, Sylvia?
We believe it's a step. Let's just say that. We believe it's one step in the right direction. We're not saying that we want universal health coverage or healthcare to be achieved by in 4 years. Okay. What we're saying is that it's a step in the right direction, especially because right now governments are taking control in terms of how they can do healthcare financing to ensure there's quality care and at the same time it's accessible. Yes. So this particular UHC 2030, this monster that people are talking about, UHC, actually came from WHO and World Bank. This is a partnership, and that is what they're championing for. So it's a global movement, and that's why it's UHC 2030, and they aim for it to be achieved by 2030 globally. So far, we have countries like Rwanda, Kigali, your favorite capital, they already have pioneered UHC in their own ways. In Kenya here, we have Makioni County, which has already started UHC, and it's working. 1 out of 47 counties, so one Makueni.
Yes. Wengine bado we are wallowing. Kiabu wameongeza, wanasema they have a vision ya kuongeza another 3,000 beds.
Yes.
Break it down for us. Universal healthcare. What is this?
What does it exactly mean?
Prof, universal healthcare is really about quality healthcare, accessible to all, but using a financial structure. To ensure that governments are digging into their pocket and ensuring that, one, there is healthcare facilities that are available for different people, and looking at the structures that are there in terms of what is the need, where is the need greatest, and then investing in that. So we say, like, for example, how they did it in Makueni County, the reason why I'm using this, because it's already working, is that they had to go back to the community and ask them, what would you need most?
Okay.
And they realized the first phase is that they invested in bed facilities to ensure that people admission and things like that are not too expensive. You noticed just the other day someone had to kidnap his exactly.
Oh man.
So how this is working is that, so they started in a phased approach. They started with ensuring that people have access to that, and it was free, completely free.
Okay.
And then they come up with a mechanism, because that's what is most important. They came up with a mechanism where maybe 500 shillings, a household pays 500 shillings per year to ensure that you cater for the rest of the county. So it's more or less owned by many people.
Okay.
So as much as like your household and my household are a bit different, and we might not need this healthcare. So it's a bit of insurance, but not really. But it's more or less taken and owned by the government. But as you know, health is a devolved function.
Yes.
So what we're asking for, and that is why I believe the president is looking for buy-in from counties to ensure that they own this and they sort of lead this, because now healthcare more or less is a devolved function. Also to ensure that there's a health workforce that is there. But what I'm here to talk about is really about youth and about how to mainstream youth in this health agenda.
Okay.
We know that there's a lot of issues that are going on currently. We heard about pregnancies just during the KCSE examination. We heard about a lot of issues such as HIV prevalence. We have 51% of young people, most of them actually present themselves with HIV. That is below 24. So those are
51%. 1 in 2
in Kenya. Yes. So this is something that's shocking, and most of us NGOs keep speaking about it and keep asking governments to do something. And it's about time we had a formal sort of cohort that is there to look at accountability, and that is there to also look at what push the government and say, what can you do? As much as this UHC, we believe in it, what financing can you provide for young people to ensure that there is one, there is preventive services, preventive meaning promotive, trying to say educate these young people on sexuality, have access, invest in contraceptives, because right now, by 51% of young people, by the time they're 15, they've had sex, for example. So the biggest cases here are that and also mental health issues. So those are the things that we need to talk about.
Mental health and alcoholism is another one. Especially in county number 022. Man, young people drinking themselves to death. And then drug abuse as well, Sylvia.
Yes.
Drug abuse on the rise. You saw yesterday's newspaper headline.
Yes.
Young kids.
Yes, have been introduced.
Yes. And this is an issue that really is tied on to mental health as well. And there's need for investment. When you go to KNH, when you go to the facility there, that is actually supposed to be for youth-friendly services. It's supposed to be a sort of conduit, sort of lead people to the next service. But what they've ended up doing is investing so much in psychology, investing so much in providing counseling services and things like that. And that is what we need to think about. What is the need first? Then start investing in that, especially with county governments. They need to start thinking, what are the needs that the youth have? And then they start investing in ensuring that one healthcare force or workers are available and paid properly. And then at the same time, there are those people who they're also trained and equipped so that they can provide those services for young people.
NHIF.
Yes.
Does it work?
Well, the thing is, there are very many approaches to UHC, by the way. And NHIF does not have to be that approach. That is a proposal currently from what I'm aware of. And what we're aware of is that NHIF, you're supposed to come up with your own structure in terms of how this will work. If NHIF is a mechanism to go, then that's okay. I'll not be here to say, okay, this is what works and what doesn't, but what I know currently is that UHC has been launched in some pilot counties to sort of assess. So they're supposed to come back. We're collecting data to try and see what happens there. And what we're asking again, and we're still knocking at the door, is that youth get engaged in this situation. And now we're hoping that this data really presents itself in a very realistic manner to attend to youth issues. So that is what it's about. So NHIF, yeah, it's a bit, it has a lot to work on, especially in terms of trying to align the structures. But what we're saying is that UHC is really about commitment from government and investing quite a bit in ensuring and make sure that investment also goes to the right places.
When you talk about universal healthcare, again, it's part of agenda.
Ama hata tuelewi, unajua saa zingine labda you want to support as a youth, lakini ujui hata ni nini. Where do you plug in?
That is true.
How do I help?
And that is why people like us have formed this Youth for UHC movement. That is why we want to start this Youth for UHC movement in Kigali. We are going to bring a number of leaders, young leaders, to sort of come up with this cohort, this movement that tries to say that, one, young people need to engage in UHC, learn about it, because I know people are like, what is this UHC?
Yes.
All I need is affordable services, because that's what most young people talk about.
Yes.
I want to get to a facility and know that I can get what I want at an affordable rate. Right now, unemployment is a very huge issue. So if they can go and actually get it for free, that would work. And it's about time, and you'll hear us quite a bit, I think, once the UHC, Youth for UHC movement is formed. And what we're going to be speaking about is that exactly. The fact that we need to raise awareness of UHC amongst young people. We are able to also face governments and tell them.
Speaking of awareness, there's a conference in Kigali next week, you said.
Yes.
Tell us a little bit about that and what you expect from it, because there is a youth pre-conference on the sidelines, right?
Yes.
Tell us about it.
Okay, so the main conference itself is happening from the 5th all the way to the 8th. And that's also supposed to bring together leaders from all around the world to discuss the health agenda, which is focused on UHC. Our GCEO is actually the current UHC co-chair, global co-chair. So that also gives us some advantage. So the pre-conference now is supposed, with many pre-conference, we're supposed to be discussing an agenda that is critical. And one thing that the global team at UHC 2030 have established is that youth need to be engaged. And that is what this is about. We're going to be launching a survey tomorrow. And the survey is about collecting views of young people. So we are not just going ahead to speak about it. We need to collect views during this conference. So as much as we are providing skills building for young people, that means we're giving them the information they require and also arming them with the necessary skills to be able to face their leaders and come up with actual plans within their countries. We're also now looking at collecting their views all around. So we'll be launching, and when you follow at a hike youth on Twitter, you will see that, and I think a hike youth as well on Facebook. We will be launching the survey, and this is something that we're encouraging young people to actually participate and actually give their views, because this is very, very important.
That again is AHAIC, right?
Yes, exactly.
A hike youth.
Yes.
That's what you call it.
Yes.
Okay.
Yes.
Look, question here. I mean, a lot of people ask, do we take our health for granted, especially the youth? Do you take their health for granted?
Extremely. If there's one thing I'd say we take for granted is health. Like, look at, when was the last time, let me ask you, Professor, when was the last time you went for a medical checkup?
Well, unless nimeforsiwa. Kabisa ile nimeambiwa HR anahitaji makaratasi.
Ile unaambiwa uchore saba.
Yes, angalie sijui. What are they looking for? Kwanza hiyo position peke yake is scary. Hiyo ndio kitu inafanya watu wengi waende. It is traumatizing. HR tafadhali.
Sylvia, you see that? You see how traumatized?
Kwa sababu hata mtu mwenye anakuambia anakufanyia check up, kwanza anaje introduce vibaya.
Na hana gloves.
Mimi naitwa Joroge wa Kafali, I'm a medical practitioner. Kama wewe sema practitioner vizuri, how can you check me? I'm a medical practitioner.
Ndivyo nasema?
Hey, I'm a medical practitioner.
Na hana gloves.
I'm hana gloves. You see the trauma we go through.
Yes. And I think it's about time that we actually owned this and realize the statistics are there. When you go and you realize you're getting sick, and then you are actually tested and you find out that you're HIV positive, for example, we are leading a life that's a bit reckless as young people because we are assuming we're young people.
They think they're invincible.
When was the last time you went for your medical check?
In November.
Yeah.
Twice a year I go.
You do?
Yeah.
Lakini unajua miaka. You're talking to a different generation. The youth and the early men. You want to talk about that?
Yes, that's why I'm looking at that comparison.
Yeah.
Because when you ask a young people, I think when you start realizing that, I'm sorry to say this, that you're nearing the grave. That's when you...
Yes. Unaona mali mmoja.
Vile anasema sana.
Umetafuta hii maneno bali. Ungeanza interview hivyo. Watu wengi wanaogopa. Wanaanza kujitari.
Anatusi asubuhi hivi.
Ameanza mapema. This is my friend. Thank you for coming.
So the closer you are to your grave,
the better for you to dig in. Enda uangalie ni nini uko nayo.
Chora saba.
Yes. Unajua unaanza kuwa na magonjwa ambayo hata uelewi.
Yeah.
Masikio inauma na sio ndani hapa juu. Macho inajifunga katikati ya miti. Si usingizi.
But you see, this is a problem. We're so casual about it, and yet maybe your partner could be HIV positive, for example.
Yes.
Then you end up falling into that problem.
Yeah.
I mentioned 51%.
you know what, Sylvia? The problem with this HIV thing, you know, because of ARVs,
Yes.
introduced almost free in some parts, people start realizing it's not such a bad thing. So
That's true.
remember, before was a death sentence.
Yes.
In the 80s, 90s, early 2000s, when HIV was was hugely prevalent and everyone used to talk about it, it was a death sentence. You were heading to the grave. Now there's ARVs. People say, "Allah, si tuendelee kazi."
Kakiendaka kuenda. In fact, we are afraid of pregnancies more than...
That is very true.
Yes.
I was about to say that. Most people are actually afraid. Many statistics are pointing to the fact that very many young people are more afraid of pregnancy than they are. But again, that's a problem. We have issues like abortions that are happening unsafely, you know, because of that. And those are the things. It's a problem with the healthcare system.
And look at the young lady yesterday. Was it Nairobi Women's?
Oh,
13 years old,
Yes.
discovered she was pregnant, walked into the bathroom, choom, just like that.
Really sad.
Just like that.
Yes.
Listen, tweets are already coming in very thick and very fast. Mitch Kitoy says, Kenya will need quite some time to achieve this UHC. If nurses and doctors cannot go a year before striking for salaries, UHC will need a miracle to establish by 2030.
I actually agree. But I think we need accelerated action. That is what we need to think about. Accelerated action in terms of the kind of commitment that's there, and also people, stakeholders coming together to actually come up with a proper structure to work with the president. I'm not here to speak for the president.
Kuna kazi watu wana campaign sasa.
No, people are imposing. Kuna ma-imposter, wengine wananyang'ania na shilingi.
Kuna board member mahali.
Inaweza tokea. For the youth and the youth agenda on HIV.
But for UHC to actually work, all stakeholders need to come on board. Everyone is come on board to come up with the best way for it to actually work. We know that Obamacare, for example, that time when it was introduced, it got a lot of backlash. And he was talking about UHC.
A lot.
Because people are like, why are we paying, why are we taxed? Why are we being taxed for healthcare and things like that? And it's good because we need a lot of public participation when it comes to this. Such views, for example, are very important. And I do hope that government is listening, even at this point, to say that how do we engage people when, again, and I emphasize the Makueni County case, they went and asked people first, what works? How does it work? And now they're investing quite a bit in terms of, and when you notice, the bigger investment is actually coming in terms of the salaries. That's one. And also the structures, the infrastructure. If we're able to actually deal with that at that point, then we can be able to deal with many other things. And of course, corruption.
Being part of the big 7 agenda.
Because of the challenges, and I'll challenge most counties, is that most of the time, and what we found in terms of the healthcare budgeting, is that they go ahead and start budgeting for infrastructure. And infrastructure, that is where you find quite a bit of corruption going on. Because if you say there's a building and you bring in a contractor, there's a challenge there. You know, obviously there's a loophole that we're talking about. So those are the things that really we need to think about and dealing with, and saying that let's go ahead and work as stakeholders and have a lot of participation in this. Yes, but I do agree that yes, there's quite a bit to be done.
Moses Kimneti says, Jeff, say hi to Sylvia. Ask her, how is UHC achievable when unemployment in this country is so high, especially amongst the youth?
That is Very, very true. And that's why we're trying to say that I do hope that we are actually able to front this conversation and in form of a position paper that is going to be presented to the president, hopefully, to start youth talking about this. Like, yeah, unemployment is a big issue. And there are many other social issues that we need to deal with. And we understand, especially with young people, what is there, what is being accelerated for them. And one thing that has been, people have challenged a lot in terms of the system is that there's need to be ownership, especially at government level, in terms of taking this on board. Yes, we're having this big four agenda. And as young people, we're saying, okay, where are we? Where do we fit in? Where are we being engaged? And that's what we're asking. So we are hoping that even with the big four, where are young people in manufacturing, where are people in, and we need to start. That's why we started this Youth for UAT movement, to start saying that, okay, for us, we know we can speak strongly about health, and we know we can do something about this. So it's a challenge to young people as well, to try and form these movements and try and push for that change and trying to do something, especially in terms of unemployment as well. Because if you're a force, and we're actually 60% of the population is young people. So why are we having this issue of unemployment or this, and yet we're not fighting? And why are we letting things like corruption take place? Are we actually one of the people? Are we one of the stakeholders in terms of corruption? And what can we do in terms of changing that culture, in terms of challenging that culture as well? So
you're letting corruption take place because you can get away with it. That's the bottom line.
Simply.
That's all.
Yes.
We are talking live to Sylvia Wamugi of AMREF. What part of AMREF?
AMREF headquarters.
Okay. Who's the boss of AMREF now? Who's the chair?
Oh, the GCO. His name is Gineji Kitahi.
Oh yeah, I know him.
Fantastic guy.
Yeah, good guy. Very good guy.
Yeah.
And we are talking about universal healthcare, especially for youth. Is it attainable by 2030? What are your thoughts? By the way, give us your social media handles again. The hike and all that.
Yes. It is a hike youth at a hike youth. And then you can follow us at Youth Act KE. We are a movement already in Kenya called Y Act, so Youth Act KE. What we're hoping to do is that we're able to actually bring youth together and they can speak about these issues.
All right, young people who are listening. By the way, a hike is AHAIC. We're going to take a break, come back, plenty more ahead. 36 minutes past the hour, 7 o'clock on this tasty Tuesday on the hottest breakfast show in all of Africa. Hashtag
Jeff and Hamo on hot.
Katiba Clyde. What you got? From Youth in Action.
Yes.
I don't know what she's telling us, man. You know, maybe she's campaigning for a job inside State House or something. Lakini wajiangalie.
Yes.
By the way, Sylvia joins us from AMREF talking about universal healthcare for the youth. Is it attainable by 2030? Beatrice Elachi, Madam Speaker. Do you know her?
Yes.
She says, morning Jeff, tell Sylvia thank you for that advocacy work on health. I agree it is important to fight this culture of corruption. If the youth stand firm, we can change. Madam Speaker, She says, keep up the advocacy work. But it's an uphill battle, Sylvia, let's face it. Until you get sick, nobody gives a damn about health. Yeah.
Until you sikia kabisa sitoki kwa kitanda sasa.
Do you agree?
I do. And that's what we need to start doing right now. Start investing in actually going to access care. Hamo, I think I need you to promise me that you'll at least go for a medical checkup.
Unajua tuko na shida. Wacha nikwambie.
Only move from Canada. She's saying at least go once a year.
No, kuna shida hapa. Wacha nikwambie. Kwani natafuta kazi kila mwaka. I'm not planning to be fired anytime soon. Tunataka check up ukitafuta kazi. Hiyo ndio kazi. Let me tell you. HR akikuitisha medical report unamletea. Lakini tuko na culture mbaya. Hata tukipatiwa dose hatumalizaji. Ndio maana kila nyumba iko na cabinet. Takona dawa za ajabu
expired.
Ukiumwa na kichwa kuna niko na kadawa kingine nilipatia na kanisaidia. Kila mtu. So I think we have your cultural change. We need to
we need to start taking responsibility for it.
Yes.
We need to start doing something more. It's really about a mind shift. And if we can just shift and just start thinking about the fact that we need to own our lives.
Yes.
You know this thing about YOLO, you live only once.
Yes.
Kind of culture that's there, and that is why there's also this whole thing about drugs and all this kind of negative influence that's going on.
Yes.
Because people are like, yeah, YOLO. So
YOLO.
it's not a big deal.
YOLO.
You live only once.
Hey.
And
Hey. That's dangerous. Tell me something, Sylvia.
Yes.
How come it has worked in Rwanda? We always wonder. I mean, and everyone says, oh, Rwanda is a village, it's a tiny place. Obviously, it can work there because the population is so small. It's not the case. Why has this worked in Rwanda? Is it leadership? Is it attitude? Is it the will of which we don't have here?
Watu wote wanaweza itwa mara moja kwa assembly and just disseminate information.
Yes.
Is it?
What is it?
I think you pointed to a few things. One, it's the will, and if someone has in Rwanda, if someone has a good strategy to front, they're willing to listen, and if it's something that works for their citizens, they're willing to invest in that. Sometimes it takes some level of control and some level of seriousness in terms of saying, you know what, I'm going to crack the whip right now and say that you are responsible for this, and people and governments are ready to be held accountable, and that's the thing. So look, Rwanda just the other day had just recovered from the genocide, and when you look at it now, we're looking at people who are ready to actually rebuild their system and work so hard towards actually making sure that Rwanda thrives again. And that is why we're having the conference in Rwanda anyway. It's a great case for many, many things. It's not just healthcare. We're having investments being done in healthcare. They have this community, they have something called a community card. So when you want to access if you want to access any form of healthcare, anything, including cancer treatment, you just need to present the card. And how they've come up with this system is that they brought on board a number of special advisors to be able to sort of come up with a structure that's thriving. And we want to go there and actually learn from Rwanda and try to understand what we can do in our countries so that we can make this work. So basically about the card, so when you present yourself with this, then you can access any healthcare. Then each household as well is also charged with the responsibility of paying some sort of money. So it's not necessarily insurance, because that's not what it's called, but you pay some money to government to be able to facilitate this. However, this is just, you know, if each household actually contributed 500, we're talking about billions of money anyway. Government needs to invest a lot of money in this. They need to actually take this seriously and say what? Because the thing is, as much as we're seeing private sector and all these other sectors coming on board to partner on this, there's the issue of actually ensuring that there's sustainability. And sustainability will actually work if the government is committed, first of all, to ensuring that there's quite a bit of money invested in healthcare. Because when you have a healthy economy, then it's a thriving economy. A healthy economy is a thriving economy.
Oli Moo, all the way from Calgary, Canada, says, why is it only for the youth? It would be better if everyone can access it, because it's a good plan. We have it here in Calgary, in Canada, and it does help.
Fantastic. Actually, right now, I'm here speaking for young people, and I'm hoping that next week there'll be someone else speaking for elderly, and there'll be people speaking for everybody. That is why I'm here. And what we're saying is that the youth have been sidelined. And you see systems in Canada, for example, it's working for them. And if we are able to look at cases and the success cases as pointed out, and try to learn from them and see how we can implement this, then this would really work for us. Let's be realistic as well. Sometimes people go and do this, what do you call this, trips?
Benchmarking.
And you know, but you know what, Rwanda compared to somewhere like Singapore, something like that. Let's be realistic and so let's go here. Let's even go to Makweni. Let's go to Makweni County. See
like people went to another nation alafu wakatumwa Githunguri. Wakarudishwa Githunguri hapa kuona dairy farming.
Hapa tu. Walikuwa wameenda Australia.
Wakapa hapana Githunguri iko na kitu kama hiyo. Imagine.
Benchmarking.
Yes.
Ngongu Kiari says, we are far from achieving universal health care, but with people like Sylvia and Governor Kibuda Kibwana, we remain hopeful. Baby steps towards the right direction.
I agree. Baby steps towards the right direction. Yeah. This is a step. We're hoping that maybe most of us may call for legislation. I don't know. I don't want to throw some political turmoil in the water, because again, we're saying fine. What happens now that this is it's an agenda for 2022?
Yes.
We're talking about 2030.
Yes.
So how do we ensure that this is owned? That the next person does not come in and say, no, it's not working. Let's try something else. You've seen that case with the government in the US, saying this is not working. So So we need to really think about how this can be structured in such a way that it's sustainable. So those are the things, and it's good that many stakeholders, as I said, are on board to try and bring this. And again, I'm requesting for as many people as possible, young people, to join our movement.
Yeah. How do they join?
Okay, so when you go to ahike.org/youth, then you'll find a tab there that says join the movement. So right now we are currently online, but we're trying to see how we can propel this after the conference when it's launched and when a structure is actually formed. Then now from there we can now start saying, okay, let's start doing something. Let's start calling our governments to action, especially on youth issues.
Yeah. That is ahaic.org/youth. Right? Join the movement, folks. Maybe this dream will not be a pipe dream, but a reality.
Kabisa.
We've got 11 years.
Yes.
Ni hapa tu.
Tuko hapa.
2030 ni hapa.
Tuko tumesema 4 years. Yeah, big dam. Here we are.
The dam hasn't been built.
Gazeti ya kila siku. You just change the date.
Another day, another scandal.
Zinaendelea the same thing.
I think it's a very frustrating position.
It is. Kwanza as a youth, nafikiri ndio hata kitu ngumu kwa sababu you wake up every day and you see these billions.
That is true, because that's a culture right now. Why should I care? Why should I care when I know that this will not even work anymore? You know?
And then you're told pay back your help.
Yes.
Pay back your help. People are stealing billions on the other side. As a youth.
So shike tu mmoja alipie watu kwanza. Mmoja tu. Hatutaki wengi. Lipia tu help ya watu wengine. What is wrong with our nation?
Sir Alano says, I think the problem with Kenyan leadership is that they try to implement everything because other countries are doing it. Let's face it, we can't make such big strides without failing. Hey, look at the tablets project. Hey, tablets ili commission.
Tulichange. Tulisema sana tunataka kutengeneza inaitwa IT hubs. So tablet tumewachana nayo kwanza. Na tukuambiwa ni kwa nini ilisimamishwa tu.
Tuanze na hubs.
Sasa ni hubs tunataka kutengeneza kwa kila shule. That is another beauty. Beautiful.
Ni hubs on the herbs.
Ni hubs. Because whoever came up with that decision who must have been high on hubs. We are proud of you. Whenever they are.
Sylvia, if someone is listening to you for the very first time, what do you tell them? How do you encourage them that this is not a joke? This is no laughing matter.
Okay. So UHC 2030, it came about because it's an ambitious goal at the global level. So this is not something that has been just fronted by the president himself, but it's something that we are asking people to actually get on board because it's been tested. It's something that's being advocated for by the World Bank and WHO, and these institutions have been there for a very long time. So what we are trying to ask right now, I'm standing in for young people, and I'm here to say that there's hope in UHC. And again, as someone just said on Twitter, is that we start with small strides, baby steps. Baby steps. And we will be able to get there. And if you want to join the movement, so you can be able to get more information, please get on ahaic.org/youth so that you can join us, so we can have this meaningful conversations on this. So that is what I would want to say. To young people.
Dangote Kilonzo. Some of this Dangote names, you know. So this lady is smart. His Excellency the President should meet her. I love her common sense thinking.
Lakini usiingie serikali kwa sababu hapo ndio common sense inakuachiaga. Most people wakitafuta kazi wanakuwa na common sense. Lakini ukipata tu hivi
kusha common sense naenda.
Tuliambiwa hapa jana. The easiest way to walk away from common sense is join government.
Yeah.
You know, it's so interesting because when you speak to government stakeholders, they will say the government, and you're wondering, aren't you in the government?
Yes.
So that makes it a very difficult conversation to have. So I'm happy to be out here.
Oh,
To try and
Well,
change
stay out there. And good luck in Kigali next week.
Yes.
After that, we see the way forward, I guess, right?
Yes.
Remember, it's 11 years to 2030.
Yes.
Simbali.
Sio Mali.
Yes, I'm hoping we will be sitting here again and I'll be speaking about great strides we have made.
I'm sorry, are you just inviting yourself back?
Yeah.
I have a confidence. This is the youth we are looking for.
How are you?
Yes, mtu anataka kuelea kitu.
Yes.
Si ati anangojea invitation.
Nikitoka Kigali.
Nitarudi sasa niwaoneshe wapi tunaenda. Thank you.
Sylvia Wamugi, Communications Manager. Thank you so much for your time. Appreciate
Thank
it.
you.
Keep doing what you do, my dear. And don't worry about us. We are skeptics by nature, and we are the devil's advocates. That's why we're here. So fear not, because this is what we call.
Catch Jeff Koinange and Professor Hamo every day, Monday to Friday from 6 a.m. to 10 a.m. only on Hot 96.